And we have Stephen Mwakesi, who is already in studio, who is a public policy analyst. Karibu tena sana. Our topic today is the rising COVID-19 surge, the curve, as we like to call it. We've been saying for a while that it will be flattened at one point, actually. It did seem that it was flattening, but let me just get it from you, Stephen. From your perspective, where did the rain start beating us? Because if you're looking at the numbers right now, they are not pretty at all.
Well, I could say that this started the moment we began to see a downward trajectory in terms of the COVID cases being reported every day. And the president was right by the time that he convened the session where the National Conference on COVID-19 in September. And from the discussions that were going on, it seemed that it would be okay to begin to relax some of the measures that were there. We saw an extension of the curfew time going up to till 11 p.m., reopening of bars and things like that, and the increasing of numbers in funerals and in church gatherings. But I don't think Kenyans understood that this was dependent on how best we as a people carry ourselves during this particular pandemic. And it involved making sure that we stick to the guidelines and the measures that were put in place to safeguard us against the surge of the second wave. But now here we are. We've been seeing that from the numbers alone, and in this 1 month that we've had the relaxation of these measures, there's been the highest number of recorded deaths within this whole period of the pandemic. And this prompted the president to now seek to convene an extraordinary session that convenes on Wednesday, in which they would relook at whether the measures that have been in place and the controls that have been in place, whether they've been followed, whether the protocols that were given to Kenyans were followed by them, are they still adhering to the measures? And this is the situation we find ourselves in. But what's troubling is that during this period, we've seen a laxity on the part of enforcement agencies. We've seen that Kenyans are walking around without masks. We're seeing social gatherings, there's no social distance. We're seeing that there's some wanton disregard of the measures that were already put in place. Political rallies are all over the place. We are seeing a number of people also taking casually the requirement that when you see some symptoms, you're meant to at least report. So we're having people just falling off. And these are the things that we need to now rethink and ask, are Kenyans taking this seriously as they should? And I believe that this is what will be evaluated on Wednesday, and we should expect the president to come up with some measures come Wednesday afternoon. The trajectory, being BBI, being all manner of things that people are preparing for 2022. There are by-elections which are actively being slated for December the 15th. So the country is in a political mood whether we like it or not. And there are gatherings that are happening and things like this that are happening. I think it is a quagmire, especially for somebody like the president, who has to sit down and balance all these interests, because the people themselves want to continue gathering, continue having discourse on things that matter to them. BBI is a national conversation that matters about, it takes a toll on what happens with their daily lives going forward. So you wouldn't blame Kenyans for showing up at rallies. You wouldn't blame them for showing up at gatherings whereby they need to hear and listen to their leaders. Remember, we had a lockdown that made people not listen to their leaders only via television, and not everybody had a television at the time. So you wouldn't be surprised why Kenyans are congregating and coming into these political gatherings. But the responsibility remains with what Senator Kasanga said. If I call you for a rally, make sure that I have made every single provision to actually ask you to stay in a manner that encourages social distancing, and encourage you also to wear your masks and even be in a responsible setting when you're at that particular political rally. We have not seen this. We have not seen this, whether it's the president, whether it's the deputy president, whether it is the Raila Odinga or any other political leader who has held a rally in this country. And these are the things that we need to have a national discourse on, because I do not believe for any one single reason that we will end up not doing these political gatherings. They will happen.
Stephen, overstretching of the facilities, we are saying doctors are actually complaining, and they are tweeting about it on social media, and they're saying nikubaya. Should we be afraid as a country?
We should be afraid. And you see, what's the paradox in this country is that in one point, this COVID really exposes one element that's very critical healthcare system. And that's the issue of ventilators and ICU beds, because when you're at a critical stage, you need these two facilities. But what's funny, at some point last week, there was a hue and cry that there are no available ICU beds all over the country. And at the same breath, you'd read in the newspaper that Kisumu, a referral hospital, the Jaramogi Odinga Referral Hospital, is saying that we are shutting down our ICU facility for lack of patients. So you see there's some discordance somewhere in terms of how we're managing this thing nationally. And I think we dropped ball. The true facts of the matter is that we dropped the ball. It's time that we as policymakers and anybody who's interested in taking care of this country starts relooking at where did the rain start beating us. Are we having an effective coordination between public and private hospitals and management of the same? I'll tell you this, under the Ministry of Health, the provision of ICU ventilators and ICU beds and all that thing is provided under a mechanism with some of the private sector players. There are some spaces in this particular country where governors are saying, instead of an ICU bed being put in a facility that can actually be able to cater for all the other attendant measures, you know, so that the moment somebody comes out of ICU, he can be able to be taken to other recovery procedures. ICU beds are being put in hospitals for political expediency, and those hospitals are not able to even manage ICU patients. So somebody is being moved from one hospital that has no ICU bed, taken to a place to stay during that ICU recovery period, and then transported back to another, to the main hospital to now continue with their recovery. This lack of coordination and ability to see how best can we manage these circumstances as they emerge is what we've been lacking. Now, if I could quickly just point out...
30 seconds, please. Yes.
We, as a country, need to wake up and say, right now it's time that we take these measures seriously. We need to tell our people to begin to wash their hands and to take COVID protocols much more seriously than we have before. It's time we do this so that we save this country.
Thank you very much. If you look at the situation that we are in right now, and we look at the West, like we've mentioned, the UK, Belgium, France, and major players such as Germany are shutting down, why are we not following suit? Why are we not taking the baton literally from them and doing the same here?
Well, I'll tell you, Paul, the announcements that were made by all those European countries were made over this past weekend, and it's because of the surge in numbers. But even as you see from the proposal that was made by Boris Johnson on Saturday about the measures that he's looking into, they're very soft. They are not like what we would have expected before. And the idea is that we really must try and keep our economies moving, regardless of the fact that we are experiencing a surge in numbers. Now, I would also recommend the same, that it's best that we look at what are the key mechanisms that we can put in place that will ensure that the economies keep on moving, that people keep on doing business as they are supposed to be doing business, and that we do not constrain the little progress we've made post the lockdowns that were experienced before. Now, on my thinking and looking at what has been mentioned by Senator Kasanga, it's very important that even as the government considers any measure, either lowering the curfew times from 11 to lower, or maybe restricting some movement, if any, or in some particular regions, the most important thing that we would have to look into is what are we doing to put money in people's pockets, because that's the most important thing. Now, since the beginning of this country, there is no other time that the Ministry of Education has received such a significant budget. I think about 497.7 billion is a significant amount. Out of that money, 1 billion shillings was set aside just for the DESK project. And as has been mentioned, if this money was reaching the people as it was intended, right now we'd be having people discussing things from a very different perspective. The credit guarantee scheme that was proposed by the president, even at the last conference on the 20th of September, he said that the banks will be cushioned for micro and small scale enterprises to be able to borrow this money. But these credit guarantee schemes have not yet been operationalized. The other day they were talking about that if you're going to receive this money, you should be a publicly listed company. So new roadblocks are being put up whereby we should be encouraging these small companies and enterprises to be able to thrive even as we are trying to recover from this pandemic. So my urging to both the government and to also other players within the private sector is that we need to really push for more economic measures to be pushed down to our people so that we can be able to thrive more.
Right.
I've been pushing for discussions whereby the Council of Governors should consider during this period till the end of December, regardless of any measures that will be taken on Wednesday or not, that small business scale owners should be cushioned from paying market fees and things like that. These are the things that will help our people believe that as policymakers, we are concerned about their plight and what the things are happening, the things that are happening to them.
Right.
So in my view, come Wednesday, the President and the Council of Governors and everyone else who will be attending that conference, it's important that we do not take any measures because others are doing it.
Okay.
We should take measures that are aimed at specifically trying to contain the spread of this particular virus. However, we try as much as possible to make sure that we are empowering our people through providing the right finance incentives to help them to do what they can do to thrive.
In regards to what you've just said, we are calling this one an extraordinary. You just mentioned right now we had one in September.
Yeah.
Was it also extraordinary, or is this just a term that they use to describe these kinds of meetings?
No, the September one was a national conference on COVID-19. It was well televised. It was done live. There were inputs from experts and the Council of Governors and people from the ministry. And that really helped to really evaluate as a nation and hold a national discourse on where we are and the measures that we've taken. And we lauded ourselves for having taken all the right measures, and the numbers were declining and it looked good.
Right.
But then after that, the President then felt, after consulting, that we should at least relax some of the measures. But he did put a caveat, and it was very clear that in the event that the nation does not take these measures seriously, we will go back into lockdown. And so by the fact that if you can read the press statement that was issued by State House recalling for this extraordinary summit, one of the key reasons that was given was that the high number of cases reported and the deaths reported in the month of October alone has caused a sense of alarm to the point whereby we would need to have an extraordinary summit that discusses what are the measures that have been taken, have they been followed, do we need to take additional measures to tame down the numbers and keep it low.